Today's discussion will revolve around medication administration via the intravenous route. So, why would a provider choose to order treatment via the IV route in comparison to other routes? First and foremost, the intravenous route is beneficial for patients who cannot tolerate oral intake of medications or for patients who suffer from gastrointestinal or absorption issues that would prohibit the breakdown or absorption of an orally administered medication, resulting in ineffective therapy. Another reason is because medications and solutions administered via the intravenous route can be controlled more strictly as far as the amount and, more importantly, the rate of infusion. Infusion therapy is also ideal for administering medications to patients who have an intact and functional GI tract, but the specific medications being administered have a molecular size that is too large to be absorbed through the gastrointestinal tract, or drugs that have a molecular content that become unstable in the acidic environment of the stomach. In addition, there are some medications that can be given intramuscularly or subcutaneously, but cause discomfort for the patient when administered via these routes. Therefore, the intravenous route is a better option to alleviate this discomfort. Last, the intravenous route is also more rapid than other administration routes, simply because the medication is administered directly into the bloodstream. In comparison, oral medications must encounter the gastrointestinal tract before being available in the bloodstream. Intramuscular must be absorbed into the muscle and processed before entering the bloodstream, and drugs administered subcutaneously or sublingually must be processed through the subcutaneous tissue or mucous membranes prior to being available in the bloodstream to elicit the desired reaction. Now, there are some reasons why the intravenous route may be avoided, and these include drug incompatibility, risk of anaphylaxis, speed shock, which is a systemic reaction from a drug reaching toxic levels due to the rapidity of the infusion, the rapid onset of action when administering intravenously, the risk of precipitate formation, or if the drug is known for causing vascular irritation, may also be reasons why the IV route is avoided. Some of the safeguards involved with IV administration route include safe drug preparation, choosing drugs from the approved drug list, knowledge of the Controlled Substances Act, using approved and improved drug delivery systems, the nurse's monitoring of the patient's response to treatment, ensuring accurate and precise drug dose calculations, being aware of expiration dates on drugs being administered, and knowledge of regulation related to investigational drugs being administered in specialty areas such as in oncology. The same medication errors that occur with other routes of administration are the same with IV drug administration and include inadequate patient education, inadequate drug information, miscommunication on multiple levels, issues with labeling, packaging, and naming of the drugs, such as generic versus brand or look-alike, sound-alike drugs, improper storage, inconsistent administration standards, issues with the work environment such as nurse-to-patient ratios, time constraints, and interruptions during the drug administration process, or even failure of the nurse to administer the rights of medication administration. Also contributing to medication errors is limited staff education on the medications administered and policies and procedures related to drug administration. Failure to have adequate information on our patients, such as allergies or previous experiences with medications, and flaws in the quality improvement processes and risk management strategies also contribute to medication errors. In order for the nurse to administer medication safely and prevent medication errors, it's essential that there is an understanding of a few basic concepts of the pharmacokinetics related to the medications being administered. These concepts include the therapeutic index, plasma concentration, therapeutic concentration, loading dose, and drug half-life. A medication's therapeutic index is a comparison between how much of the medication is needed to reach the desired effect with how much of the medication is required before toxicity occurs. The therapeutic concentration of a medication is the amount of drug required to reach the desired effects of the medication. For example, If a patient's receiving Dilantin for the treatment of seizures, the therapeutic concentration would be the amount of the drug required to reach the therapeutic range of 10 to 20 micrograms per deciliter, the serum level. A loading dose is a higher dose of medication that is administered initially to ensure that the therapeutic concentration of the drug is reached quicker. This is most commonly seen with the administration of steroids or antibiotics. Lastly is the drug half-life. The half-life of a drug is the amount of time it takes the concentration of the drug in the body to be reduced by 1/2. This concept is beneficial in relation to drug toxicity because it lets the clinician know how long to expect before the drug's plasma concentration returns to therapeutic or subtherapeutic levels, hence minimizing the risk to the patient. Administering of any medication, including intravenous medications, can result in patients experiencing undesired drug responses. These undesired drug responses can present in a variety of ways. First is the process of accumulation. Accumulation occurs when the amount of medication builds up in the body or bloodstream, resulting in toxicity or overdose. Dependence is a physical condition in which the body has adapted to the presence of a certain drug, which results in predictable and measurable adverse effects when the medication is discontinued suddenly. A good example of this is steroid therapy and the use of a dose tapering pack to gradually wean the patient off of the steroid regimen. Oftentimes, dependence and addiction are used interchangeably, but these are not the same. Tolerance, on the other hand, is a term used to describe a diminished response to a drug due to repeated use. This is often seen in patients being treated for chronic pain related to cancer. After months of use of certain pain medications, the patient's dosage may need to be increased in order to reach the same desired level of pain control previously attained at a lower dose. Idiosyncratic reactions are reactions that occur that are not caused by the normal reaction of the drug and are due to stimulation of the immune system by the drug. These reactions are unexpected. An example of an idiosyncratic reaction is sensitivity to aspirin causing an attack of asthma. Tachyphylaxis is defined as a rapid diminishing effect of a drug after administration. Simply put, rapid loss of drug effectiveness.